BMore Lifestyle segment is sponsored by American Heart Association and the American Diabetes Association.
Well, for years, researchers have observed a phenomenon referred to as the holiday heart attack, where deaths from heart attacks and stroke increase starting at Thanksgiving in November and continuing through January. Now, from the American Heart Association and the American Diabetes Association are Dr. Robert Eckel and actor Karen Dawson to talk about this phenomenon and who is at higher risk. Well, good morning. Dr. Eckel, talk to us about the holiday heart attack phenomenon and why mortality is higher around the holidays.
Well, I think the mortality is higher, Brandy, simply because there are more events. Okay. We know from Christmas to New Year's, particularly, the events increase anywhere from 10 to 40%. And that occurs particularly in people living with type 2 diabetes. So what are the factors related to this? I think there are many. First of all, the stress of the holidays. We all go through this a little bit, but I think this year with COVID-19 before us, the stress may be different and higher. Secondly, I think changes in dietary intake occur. Ultimately, we eat more calories and we eat foods that are perhaps less favorable in terms of managing our diabetes and heart disease risk. Thirdly, I think ultimately physical activity can change. So people can become more sedentary or also become much more active for a few, where in fact their bodies are not trained to be more physically active. You know, alcohol increases also occur over the holidays for those who are drinkers. Mm-hmm. So this is another factor that we need to think about and modify favorably. And finally, I think compliance to medications, and that's a liaison to Karen, who experienced her stroke when medications were not being reliably taken as prescribed.
Right. Okay, so talk to us about the link between type 2 diabetes, stroke, and heart disease.
Well, we know that patients with type 2 diabetes have a 2 to 3-fold higher risk for having a heart attack or stroke, or death from heart attack or stroke. Ultimately, that risk relates to a lot of things. Having diabetes per se contributes to this risk, but also blood lipids such as cholesterol and triglycerides are much higher. Moreover, hypertension is more common and more difficult to treat. And I think there are other factors that are less clear, but we know that that plaque burden, which is what leads to a heart attack or stroke, really ultimately contributes also to that additional risk. When the clot forms in the coronary artery or to the blood vessels leading to the brain, heart attacks and strokes are an outcome of that unfortunate clot in those particular locations of the body.
Got it. All right. Well, Karen, we understand that you are working with the American Heart Association and the American Diabetes Association. So thank you for that work. Can you tell us where people can go to get more information?
Well, I'm the ambassador for now No Diabetes by Heart, working with the American Heart Association and the American Diabetes Association. We now, No Diabetes by Heart has a new program to help people through the holiday, and they can text the word holiday to 22639, and Dr. Bob will be able to give you a little bit more information about the website.
All right. Well, Dr. Eckel and Karen, thank you so much for that information this morning. We appreciate you.